show that a total of 15 million people worldwide experience stroke each year. A total of 6 million will not survive, and 30 million people who have had the attack are most likely to have residual disabilities. In a data released by the World Health Organization, stroke contributed to more than 9% of total death in the Philippines in 2011.
In the Philippines, stroke is one of the most common causes of mortality. And although common, most Filipinos who are experiencing an impending stroke don't realize that they are undergoing the so-called brain attack. So to share with us and discuss with us this issue, here with us is Dr. Carter Rabo. Hello, Doctor.
Hello.
Thank you for sharing your time with us.
Oh,
I know
my
you're very,
pleasure.
very busy.
Hello.
Now, Doctor, straight to the topic,
Okay.
what is stroke?
So when you say stroke, it means brain attack. I do have this model of the brain here in my hand to tell us this is a replica of your brain. So and if we do have a brain attack, what happens is there are two types. Either, if you will note, you have a blood vessel in your brain. This blood vessel can either be blocked, causing an infarct, or yung tinatawag nating bara sa ugat na nagkakos ng stroke. Or another one will be rupture. Ibig sabihin, pumutok ang ugat. So these are the two types of stroke, either ang pumara or pumutok na ugat.
Stroke, being referred to by its old term cerebrovascular accident or CVA, is a medical emergency caused by the lack of blood supply in the brain. Therefore, causing the brain cells to die because of inadequate supply of oxygen. Stroke symptoms begin suddenly and should be recognized at once because prompt treatment is a crucial part in a patient's recovery.
Paano malalaman na nagsastroke na pala yung isang tao?
Yes, important na malaman natin ang stroke because we have a treatment if we reach the golden period of 3 hours to the hospital. So, ang easiest time dyan ay sasabing fast. Ibig sabihin face, if you have asymmetry of the face, nangingiwi ang mukha, 2 is arm. If you ask the patient to lift his arm, nagdidrip, weakness, or nagdanumb. And S, which is speech. Pag nag-slurred ang speech,
Parang naglalasing-lasing.
Naglasing na. Then, F-A-S-T means it's time for you to go to the hospital. So, isipin nyo lang F-A-S-T.
Stroke can be experienced by anyone at any age. However, it is still most common among the elderly. Various risk factors can double the chance of having a stroke. The complication of stroke depends upon which part of the brain is damaged and the severity of the attack. It can be as minor as experiencing weakness in the arms or legs, or as worse as paralysis.
So, Doctor, what are the most common causes? Bakit nagkaka-stroke ang isang tao?
So, the most common cause actually, there are modifiable and non-modifiable risk factor. Ibig sabihin, yung iba magagawa natin ng paraan, yung iba we cannot do anything about it. The most common non-modifiable risk factor is actually the age.
Yes.
So as you grow old, buti bata pa tayo. So as you grow old, you will be prone to stroke. The modifiable risk factors will be the hypertension, the diabetes, if you have an irregular heartbeat, of course, yung lifestyle mo, kung sedentary ka, yung kinakain mo, yung cholesterol.
Yes, tama yan.
And these are the ones that we can do something about to prevent stroke because stroke is actually preventable 80% of the time.
Just like any other diseases, stroke is preventable by choosing what we eat and avoiding a sedentary lifestyle, especially those who have previously experienced stroke and those who are at high risk.
So, Doctor, a while ago you said 80% of those stroke cases are preventable.
Yes.
How can we prevent stroke?
We ask the patient to at least do some exercises every day. If it's hypercholesterol, we ask them to stop eating fatty foods. If it's hypertension, we ask them not to eat salty foods. And if it's diabetes, refrain from eating sweet foods, di ba?
So, in short, discipline talaga.
Discipline,
Self-discipline.
lifestyle modification talaga ang kailangan nyo.
Thank you, Dr. Rabo. 任何人有任何类似的心脏疾病，最好的方法呢是要定期的让医生检查，好让人减少中风的风险。